and federated analytics. So Eric pointed out quite a few good differences where how we should be using citizen-based data. So we've also talked about how we can do it in the way of marginalized communities and vulnerable members, because in the UK, when they need to see the GP, which is the utmost need, which is unmet for them, they cannot, because it all depends upon the address and they do not live in a specific address, so they cannot visit the GP. So there are quite a few
Okay,
things
okay.
which are a bit out of the box that when we talk about generalized data, we don't really usually tend to think about on those aspects, like how about those people who do not have the access to anything
Uh,
to form the
that's
basis of data.
That's amazing, because that's an amazing segue for Guru intervention. And Guru, I think it's really great to have you here for these closing notes. And Guru Kora is the CEO and founder of Times Health, a company that has an innovative way of bringing healthcare to citizens. So that's the perfect segue for you to intervene. Guru, over to you.
Yeah. Hello, everyone. Thank you so much for giving me this platform to share a couple of thoughts about the evidence-based and AI's role in it. Let me start with a movement that will make every data leader in this room uncomfortable. Let's take an example of Olivia Bernstein. She is 34. She works full time. She has 2 kids. At 2 a.m., she wakes up with a massive toothache. It's so severe she cannot talk. She's sweating. She checks her temperature, fever. She does every rational person does. And she opens her phone, she searches, she gets hundreds of answers. Half contradict each other and some are even dangerous. She thinks about going to the ER. It's expensive. It's slow. And they cannot treat the root problem. Now, she thinks about waiting, she cannot. At 2 a.m., Olivia is not missing intelligence. She's missing something far more basic. She's missing a simple, trustworthy next step. That is what today is about. It's not about AI, it's not about data, it's not about innovation. From evidence to impact means one thing and only one thing. When someone is vulnerable, can the system give them the next safe action in minutes, not days? I mean, more broadly, evidence breaks everywhere. I mean, we have more medical evidence than any generation in history. We also have growing gap between what evidence says and what people experience. Evidence really breaks in 3 places. First, evidence breaks for Olivia at 2 a.m. when clinicians are not available. And second, evidence breaks at a point of care when the record and her medical record is incomplete, scattered, or completely trapped. Third, evidence breaks in workflow itself when the burden of finding the truth is pushed onto the clinicians and not the patients. This is why the same disease can have world-class guidelines and still produce avoidable suffering. So if we want actual impact, we need to stop celebrating evidence creation and start fixing evidence delivery. Access, Olivia's story is not rare, it is quite routine. The real crisis is not that people lack information, they lack access to right action at the right time. A parent with a child's fever, whether a symptoms is dangerous, an older adult who's missed a dose, a diabetic patient who does not know what to do. The system's fallback is the same. Go to the ER. That is not because ERs are the best place for the care. It is because ERs are the only place that open. So access is first break chain and evidence to impact. The access is the big deal. Now, here is where this becomes a health data executive problem. When care is available, evidence still fails if data cannot travel. Here in US, too many places, the patient record is patchwork, medication lists do not match, allergies are missing, prior imaging is trapped, notes are in PDF. So the clinicians walk into the room, start from partial truth. Yeah, there are lots of clinicians here, you can ask them. So we ask the clinicians to reconstruct the reality under time pressure. This is why interoperability is not an IT project, it is a safety project. It is the circulatory system of the evidence. Pun not intended, if evidence is the brain, interoperability is the nervous system. Without it, the brain cannot act. When even data exists, impact dies in workflow. If the right answer requires logging into 3 different systems, reading 5 documents, reconciling 2 medication lists, calling another office, then the right answer will not happen consistently. And we have seen that in US here all the time. The system will default to shortcuts, repeating tests or referring defensive medication, more clinics. So the question is not we can move the data. The question is, can we make the next safe action the easiest action? AI as a delivery layer for the evidence is so important in this now in 2026. Now we can talk about AI only with the right people. AI is not the point where AI is a delivery layer. Imagine Olivia, let's go back to Olivia, open an app. She opens an app. She does 4 things. First, it listens to symptoms and context. It uses evidence-based guardrails and tells her what's the next steps are. It escalates when risk is high because that is dramatic, because that is responsible. 4, it connects her to the right human care at the right time. And that is not placing physicians, that is preventing avoidable harm when physicians are unavailable. But here is the rule. AI without interoperability, trustworthy data is not smart. It's confidently unsafe. That's we are facing now because we are going to the second phase now. Here in US, we are facing that a lot. So the path to impact is not deploying a model, AI model. The path to impact is evidence, connected data, safe workflow, and privacy and trust. What looks like a measurable impact. So this happened to me, my wife. Impact is fewer unnecessary ER visits. I track our ER visits really well. I have 2 kids and I do that all the time. Impact right now for our family is clinicians getting time back because the system stops making them hurt. And I see that with my pediatrician, my wife sees it for a gynecologist. So that is the bar. If we cannot measure those changes, we are not delivering impact. We are delivering freaking software. So let's end where we started. At 2 a.m., Olivia did not need a miracle. She needs the system to do its job, to turn that evidence into the next safe action. If we build the data foundations, govern that evidence, and respect the workflow and the truth, then the AI becomes what it should have been all along, a bridge. A bridge from what we know to people what we actually experience. And this is what's happening in my family. I want to start with my family. So it's really important to bridge that evidence to the impact through interoperability, right guardrails for the structure. So the bottom line is we need access. Evidence impact will flow. Thank you.
Thank you so much. It's just we couldn't end this think tank session with a better way to close. I also would like to thank all participants for waiting and staying until the end. I hope they feel it was well worth it, the time here. And thank you also for the observations that you have putting in the chat notes. And over to you, Padma, for final comments and any other observations that you'd like to share and questions you'd like to ask to Guru. I think, Guru, you would take some questions, right, from the audience.
Absolutely.
Padma?
Yeah, so for me and all of us, it is really encouraging to see the kind of responses that we are getting, and also the a strong alignment around the idea that the future of healthcare using AI in the healthcare depends less on the isolated technological breakthrough, but more on this interoperability, solving the interoperability, as Guru was rightly mentioning, and also more on the disciplined work on data quality, governance, and trusted infrastructure. And today we have seen all the discussions highlighted that building credible and scalable ecosystem that requires sustainable collaboration across all the sectors and shared commitment that we need to have on the standards and bring that transparency and equity. So that I really truly appreciate Guru for his true story that had motivated him for bringing this times health in front of us. And that is really an inspiring story. Everyone, first, they need to solve their own problem, how we are solving our own healthcare problems using AI. So the same principle need to be replicated to the world when we are going to solve the world's healthcare problem with AI.
Exactly.
Absolutely.
Any questions to Guru? I think Guru is you can feel free to ask any questions about his approach to care with AI.
Yeah, while you
So
guys
I have this question. I have done a podcast also some time back. That time it was into India and other countries. So now I would like to really try to understand how far have we gone from implementing a free solution to India to what are all the countries that we are able to finally implement Times AI app.
Yeah,
one question from Eric as well, Guru. Take stock for two, please.
Right, absolutely. So, Dr. Roy, you're absolutely right. Technology on its own is not going to solve the problem. Technology never solved the problem previously. It's how you use that technology, how you actually adapt that technology to your clinical workflow makes a whole lot of difference. And the usage and adaptability of that technology results in outcomes directly in healthcare. It's all the more important in healthcare. And those two bigger problems that is hurting healthcare industry for the last 30 years, access to care and cost of care. And both of those, access to care, especially completely AI democratizes it. And one of the things that Times Health, we came out with these apps to empower people like Olivia or people like my wife who is managing all the care for the entire family, is to at least provide them, use their cell phone, which is universal, ubiquitous now. Install something in their phone and let an AI handle that, their day-to-day generic, mundane questions that they cannot afford to ask a nurse or a doctor because they are not accessible 24/7. And it's all the more important for places like rural India, rural Europe, Southern America, rural, some remote areas of Europe, where forget about any specialist or subspecialist, even GPs are not available. Primary care, getting some sort of provider is a big challenge. But everybody has a cell phone.
Yeah.
That's quite true.
So,
Eric?
So one more question before I can give it to Eric. Guru, what evidence do you have already that the app is improving the patient outcomes or care continuum?
So
Do you
yes,
have already the evidences?
there are. It's still early days, Dr. Roy, but we are not trying to boil the ocean and try to solve the entire problem. Even achieving small adjustable measurable goals like access to remote areas, some sort of care, you will save hundreds and thousands of lives just by providing that little access. So we are not trying to solve complete healthcare problems, just small measurable problems, issues where we can provide them some sort of an AI which can answer or triage their problems and give you some basic non-invasive solutions so that they can avoid the big life-changing actions that they might go through. And
Thanks,
there is
Guru.
evidence is everywhere, and that evidence is everywhere in terms of how we are deploying it in rural here in US, in rural Tennessee, and as well as in southern parts of US.
Thank you, Guru. Thanks a lot.
Thanks.
Yeah. So I wanted to lead off by saying I'm a believer in the idea of creating 5 billion health assistants. Sorry, 5 billion, 8 billion health assistants, because everyone's got a cell phone and everybody should be empowered with their own data in order to improve their own health outcomes, guided by the health professionals, and that the nature and that of the patient-provider relationship fundamentally shifts from the world where the patient is frankly more passive in their own care and really reliant upon the good advice of the white coat, to a place where they're getting their own advice. But my question, because my question is kind of contrary to that as a physician, what are you, in a world where 240 million people are using ChatGPT today to make a query about their health outcomes, how does liability work in that space where something goes wrong? Because software vendors are renowned for being Teflon when it comes to any type of liability. And so what do you think is a practical approach for a responsible way of addressing or enabling the individuals to use their own data powered by AI systems in order to improve their own care?
Absolutely. I'll give you, Dr. Sutherland, I'll give you an example what recently happened. My mom has a rheumatoid arthritis. It's an autoimmune disorder, which is very debilitating, you all know. And she goes to the doctor, every quarter, and doctor gives them a prescription. She is in India. She gives them the prescription, and she doesn't know what those 8 or 10 medications that they have written, because the doctor never explained it to her. There needs to be someone who can explain. My father cannot explain it to her, and there is nobody in India who can explain it to her. And this is nothing to do with technical help, but to improve her life. She wants to know what she's taking is which directly related to her condition. The only way to do that is for her to take a picture and have somebody and ask that prescription, what is in it? So there are, from solving a healthcare problem to, solving problems that are tangential to healthcare, but it will improve your quality of life significantly. That's where it's aiming. They are not trying to solve the entire problem. They are not trying to replace doctors. They're not trying to, completely, overhaul the entire clinical stack here. They're just trying to enable people to make certain decisions or educate them about their condition and ask intelligent questions to the doctors before they come in. So
what if
education is a big component.
But what if the AI hallucinates?
So that's one of the problems is people who are using AI and using a general purpose AI like OpenAI, Anthropic, Gemini have been written for general purpose AI solution. They are not written with healthcare in mind. That's the whole biggest difference between Times Health and these ones. Times Health has zero hallucination because we know reproducibility is really important in healthcare. Creativity takes a backseat.
So if you gave bad advice, then you would take accountability for giving bad advice because your program was not right. Okay, that's cool.
It's absolutely, but you need to be able to be responsible because you should be held responsible for the things that you talk about. And if your AI is talking and giving clinical advice, then buck stops at you.
I love that. And I think it would represent a significant sea change from how technology companies have traditionally addressed liability for their products. But I think that it's a necessary sea change.
Yeah, absolutely.
Yes, absolutely. I'm mindful of the time here. Imangi, you have a question also to pose, and let's wrap up after that one.
Yes.
Right.
So it was about very good talk, Guru. So I would just want to add to it that when you talked about how your mother does not know how to go through the prescription because the doctor does not explain in India, they have developed an app and a platform called 1MG, where people can go and check how to use the drug and the medicine. Also, one of the interesting things, I was talking to a friend back in King's College where I was studying. She was from Saudi Arabia. She mentioned how they have a system where there's a doctor who writes and prescribes every medicine, and then there is another assistant healthcare specialist which explains the patients what to do with them, and then they give detailed guidance on what the condition is, because we do understand that doctors are very busy and they need to treat multiple people. But with that assistant, it could really help because it's a patient-centric role. So I just wanted to add to that.
No, absolutely, Himangi, absolutely. You're absolutely right. We need to, there is no AI replacing everybody. You just need to use AI efficiently to improve the care. That was the bottom line. And then people doing companies like 1MD, 1MG from Tata and others are helping that a lot in that journey. And we need to expand that to the rest of the world because there is one India, there's also one, remote Europe, and then there's South America and everywhere. So we need to have that equitable point of view across the world to solve this problem.
I absolutely agree.
Yeah, and Guru, as we are talking with advanced therapies, medical products, it's obvious that it's also the case for the patient undergoing these powerful treatments also to benefit from such an approach, right?
Yeah, absolutely. There are so many aspects to it that AI can help, not just in the direct patient-facing aspects of it, in the back office where there is a revenue cycle management, there is call center assessment, there is clinical trials, there is patient engagement, there is claim chain management, all the back office operations where typically you need an entire army of people here in US to actually process and get money and get your providers paid. That needs to be operationalized efficiently, AI enabled, and then reduce that complexity that is what it right now.
Absolutely. So thank you all, everybody, for joining and staying so late. Guru, thank you so much for joining. And dear viewers, thank you so much for patiently watching us. And on the social media, I'm sure you're going to share these with everybody. That was wonderful for me to be the showrunner of the Dubai Executive Think Tank. We'll wrap up all the wonderful sentences you have shared, and we're going to be in touch with all you very soon. Thank you so much.
fun.
Thank you.
Thank you very much.
Thank you. Bye bye.
Enjoy the rest of the day. Bye.